For a woman experiencing domestic violence, support provided at a healthcare facility is often the most important intervention in her life. And for a healthcare provider, it is very likely to be their only opportunity to help the woman. CEHAT's evidence-based training for healthcare providers that has upscaled the healthcare response to domestic violence across several public hospitals details how critical first-line support must respond to both the emotional and practical needs of women. Its various components are easily remembered as the acronym LIVES. LIVES reminds healthcare providers of the 5 tasks that can protect women's lives. The L in LIVES stands for listen. Listen to the woman closely, with empathy and without judging. This forms the basis of offering first-line support. Healthcare providers must set aside commonly held notions to be able to listen to the woman sensitively.
The basic approach of this training says that listen. Previously I used to talk, but after training I learned to listen, because if you listen to someone, then you will get all the details.
Active and empathetic listening encourages the woman to keep talking if she wishes. Questions like, "How can we help you?" or "Would you like to tell me more?" can help. The I in LIVES stands for Inquire. The healthcare provider must sensitively inquire about the woman's needs and concerns.
So we came to learn that not to ask direct questions, not to give our opinion or our judgment on them, and let her speak. And once that flow starts, once that connection is established, that doctor-patient relationship emotionally is established, she will actually tell you the whole history.
For that we are asking some open-ended question to the patient. The questions whose answers will not be yes or no. There will be lot of elaboration on the part of patient. If you ask, how you feel? What is your experience? If I ask such question to the patient, she will elaborate all the things.
While inquiring into the survivor's needs and concerns, a few prompts could help her identify and express herself. For instance, the healthcare provider could ask, "Is there anything that you need or are concerned about? It sounds like you may need a place to stay. It sounds like you are worried about your children." The V in LIVES stands for validate. Women's experiences have time and again brought forth how legal judicial systems, as well as their own families, do not believe them when they disclose violence. Healthcare providers must make efforts to demonstrate that they believe her narration and provide an assurance that she will not be blamed for the violence. There are some important things that healthcare providers can articulate to validate a survivor of domestic violence. It's not your fault. You are not to blame. What happened has no justification or excuse. No one deserves to be hit by their partner in a relationship. You are not alone. Many women suffer abuse in their homes due to social norms that give privileges to men over women. Your life, your health, you are of value. Everybody deserves to feel safe at home. I'm worried that this may be affecting your health. We are here to help. It's important not to judge what the survivor has or has not done or how she is feeling. Statements like, "You shouldn't feel that way," or "You should feel lucky you survived," should be scrupulously avoided. The E in LIVES stands for enhanced safety. A woman may decide to return to an abusive home because she has children to care for or other responsibilities. The role of the healthcare provider is to communicate concern for her safety. Some important questions to ask would be, has the physical violence become more frequent or intense in the past 6 months? Have you been threatened with a weapon? Do you believe the abuser could kill you? Elements of safety planning could include discussing a safe place to go. Would she go alone or take her children with her? What would the mode of transport be? Are there any documents, keys, money, clothes, or other things that are essential? Does she have access to money in an emergency? And would there be the support of someone close by? It is also important to identify and address mental or emotional problems such as symptoms of stress, anxiety, depression, post-traumatic stress disorder, sleep disorders, misuse of alcohol or drugs, and self-harm or suicidal ideation, including thoughts, plans, or acts.
All the staff was informed about all the facilities available for these women. For example, the laws about which even we were not aware. We being the educated females, we were not aware about the law. And unless one is aware about the support, they won't look for it. Second, when they know that she is a survivor of violence, they will be in a position to give them at least psychological first aid. Third, if she demands or if she wishes, then again the staff will be in a position to guide her to the appropriate authorities or appropriate resources so that she can get her needs fulfilled. For example, some people may need a shelter, so they will be guided appropriately. Some people will just need some guidance about how to be safe or how to be ready. So in that way, whatever is the need, accordingly the staff will help them.
Right now, after this training, I know there is a safe care number which I make sure that I'm giving. I have an entry book where I'm doing the entry. I'm taking the female's number, I am giving her my number. So there is a follow-up. I know what is going to happen. I'm just not sitting and doing wishful thinking.
The S in life stands for support. This support is essential in helping the survivor navigate several practical aspects of life involved in dealing with abuse.
We introduced a resource directory which contains a list of the organizations, protection officer, the legal help, the NGOs within the vicinity of the hospital for the additional support services which are beyond the scope of the hospital.
तर सेहतमुळं खरोखरच मी खूप सक्षम झाली असं मला वाटते आणि सेहतमुळं आणि या मुक्ता प्रोजेक्टमुळं आमची एक बघण्याची नजर बदललेली आहे. पूर्वी पण पेशंट येत होते, बघत होतो. बायकांचे असे प्रॉब्लेम नवऱ्याने मारलं किंवा काही त्यांची इतर प्रॉब्लेम त्या बोलत होत्या, पण ठीक आहे असं एवढं त्यात आम्ही गुंतून जात नव्हतो. पण या प्रोजेक्टमुळे अगदी त्यांचं आम्ही डिटेल सगळं विचारतो किंवा त्याही अगदी आमच्याशी मनमोकळेपणाने बोलतात. त्यांना आम्ही भरपूर वेळ देतो. त्या अगदी आपल्या मनात म्हणजे कुणालाही सांगता येणार नाही असे प्रॉब्लेम पण आमच्यापाशी बसून त्या अगदी मनमोकळेपणाने सांगतात, त्याच्यावर चर्चा करतात. मग त्यांना खरं तर बाकीच्या गोष्टींची काही माहिती नसते. त्या सेहतमुळे आम्हाला पण ह्या बाकीच्या माहिती झालेल्या आहेत आणि त्यामुळे आम्ही त्यांना योग्य मार्गदर्शन करू शकतो.
Healthcare providers often refer survivors of domestic violence to protection officers from the Women and Child Development Department. The protection officer's role is to facilitate various services such as shelter, legal aid, safety, and also protection orders to ensure women are safe in their marital or parental home without the arrest of the abusers.
One patient I remember, she is second gravida. She came for termination of pregnancy. Her husband thrown her out with her baby of 1.5 years, and she is second time pregnant. She is 6 months of amenorrhea. As we all know, MTP cannot be done at that gestational age. So I admitted her. I asked ward sister to counsel her. Then with the help of protection officer, she could get the shelter. And then she delivered, and that baby and mother both are healthy. And now she is working in some doctor's home for housework, and now she is feeling happy. It makes me feel proud also. And it gives a job satisfaction. Last week also she met me in the office and she told I am happy. So that feels nice.
So it has built up a team spirit, and everyone considers that we are doing something worthwhile, so that this menace of domestic violence, we can do something for the survivors.